Hey everybody, how are you doing? This is Kirsten here, and thank you so much for tuning in to this next episode of A Better Way with Kirsten podcast. On this podcast, we're talking about chronic pain and chronic sensations, and you probably already know this if you have been a listener for a while. These chronic sensations that are actually originating from your nervous system, and there's nothing physically wrong with you. This is what I'm hoping to help you with on this podcast. And you may also know this about me, that I am a strength training coach. I am very passionate about strength training and see this as one of the most empowering tools for everybody, but women particularly. And this is what I want to talk about today. So today's topic is 3 things about strength and empowerment that every woman has to know. And of course, I'm also mentioning chronic pain and chronic sensations here because this is very important, and chronic pain and chronic sensations actually have a lot to do with lack of empowerment, or we should say disempowerment, and strength training is something that can really help here. Of course, before I even get started with talking to you about strength training, you might be thinking, I cannot do this. Like, you're crazy. I can't do this. This is too hard. My body's way too broken. I have all this pain, all this trouble. And I understand where you are right now. I totally get it. Just the other day posted on Instagram too that there was a time where I couldn't do a single bridge, right? So bridge is the exercise where you're lying on your back on the floor, your knees are bent, your feet are flat on the floor, and you're lifting your hips off the floor. And I couldn't do this. I had crazy pain shooting up and down my back because I had this chronic back pain that I didn't know what it was until many, many years into having this trouble. And I was seeing a chiropractor and I was seeing all kinds of other things before I figured this thing out. And it ended up being, of course, nervous system dysregulation, brain problem. It wasn't anything physical. But when you're saying right now that I can't do any of this because you don't know how shitty I feel, then I will tell you that I know pretty well how bad it can get. So if you are there right now, I want to encourage you. You can get started with strength training, and your first place should really be to go ahead and get my 14-day free course, Strong and Sensitive. So what this course is, that it's a mix of mindset tools that anybody who is dealing with these chronic sensations and or is highly sensitive as a person, these mindset tools will help this type of person. You'll understand where your problem is originating from, why it is there, and it has some pretty practical tools that you can start using right away. And the other half of the course is strength training. So you're going to get some exercises that you can try out on your own. Some of them are beginners only, and others are for more intermediate level weightlifters. Whatever you are, wherever you are on your journey, you can try these workouts out. And again, this is completely free. And my goal with this is to empower you to make sure that you know where the problem is coming from. If you have anxiety, chronic pain, chronic depression, and if you don't know where to start your strength training. So this course will really help you out. It's completely free. You're going to get 1 email into your inbox every single day. That's for 15 days actually. And sign up for it if you want to get it. And I really don't know why you wouldn't want to get it. If you are in this position that I just described, it's going to be very, very helpful for you. So you can get started. Start gentle. The most important thing is like where your mindset is, right? When you're doing these exercises, when you are starting strength training, what are you telling to yourself? Are you telling yourself that I cannot do this? This is too much. I'm too weak. I'm too old. I'm too frail. I've never done this before. If you have a mindset like this, it's going to be a lot harder. But if your mindset is this, hey, I'm going to try this thing out because I know that physically I am completely healthy, and I understand that, yes, my nervous system might react to it because this is a new thing. I know that it's actually not dangerous. And let me try out this body weight program that Kirsten has. Let me check this out. And I'm going to go into this with an open mind and knowing that I'm actually totally fine and this is not dangerous. So it really depends on how you start your journey. What do you tell to yourself? And the better your attitude and belief about this, the better it's going to be. So today, like I mentioned, I wanted to tell you a little bit more about when it comes to strength and empowerment, especially for women, and some of the things that I've seen in my work a lot, as you know, when I worked as a nutrition coach and strength training coach, many things came up, and I just noticed over the many years that a lot of times people are really, really focused on their bodies and the body shape and the body size and the weight, right? The weight is a big one. And sometimes people can get very, very detailed and even like obsessed with the nutrition. All of these things I saw. And I want to say that I don't think that it's a bad idea to want to change your body composition. No, absolutely not. I'm also not saying that nobody ever has a problem with their weight or that they shouldn't lose some weight. I'm not saying that at all either. Absolutely not. But what I am saying is that a lot of women take away their own, or give away rather, their own power by focusing on this stuff way too much. So the first point that I want to make today is that when you get started with strength training, think about it as a way for you to get strong physically and mentally, rather than how much weight am I going to lose or how jacked am I going to get. This is the right starting point. When you're telling yourself, I want to see how strong I can get physically and mentally, you are starting from a right place. Like I said, I've seen so much obsession, especially around the scale. This is pretty mind-blowing, actually. And at the same time, when you are so hyper-focused on the scale weight, you may not even notice all the other things that you're gaining. You may not notice that you're showing up more confident. You may not notice that you're not taking on everybody else's emotions anymore. You may not notice that you're able to say no when it's time to say no. If you're hyper-focused on the scale, these things can go unnoticed, but these things are very, very important. So let me tell you about a couple of things that are going to happen when you regularly strength train. By the way, it doesn't matter where you start. If you start from completely zero and you're 7 years old, or when you are already, experienced lifter and you're 20 years old, it doesn't matter. You still get the same mental health benefits, and then of course physical health benefits too, but you're going to feel a lot more confident. You are going to feel like I had the right to say what I mean. You are going to feel like I don't have to ask everybody's opinion in order to make a decision. You're going to feel like, yes, I can do this. I have my own back. You're going to feel like I can count on myself. You're going to feel like so many different things that are telling you that you are becoming a more confident, empowered person. And this is what I really want for you, because there's so many women who don't have that, who are just so focused on the number on the scale or every, little bit of body fat on them. They are so fixated on that stuff that they are not paying attention to the rest at all. And in my opinion, it is a mistake, because why would you not pay attention to all the good things that are actually life-changing, that are truly life-changing? Of course, there's so many physical health benefits, and like I said, anybody, no matter what your age and experience, when you do strength training, you will get these benefits. And they are of course strong physical strength. Your muscles are stronger, you're more capable, your bones are stronger. There's nothing else that strengthens your bones the way strength training does. You're going to have better protection against heart disease, against blood sugar problems, also diabetes. You're going to stay independent longer. Believe it or not, you're also going to have better flexibility or mobility when you're doing strength training. So all of these things are just the things that I want you to focus on, that are really, I am gaining strength in so many areas of my life, instead of focusing so much on like, how is this going to change my body weight? How is this going to be reflected on the scale? And again, coming back to what I said before, I don't think this is a bad or wrong goal, or that nobody should ever lose body weight, but just what happens when you look at this from a different angle, when you let go of that obsession, and when you see all the positives that you can gain. Focus on gaining instead of focus on losing so much. And once you can make that switch, it is extremely empowering. So many women are also obsessed with like, oh, I cannot eat this and I cannot eat that. So many rules. And I've been there, I've talked about it openly. I had like 7 years of eating disorder, and none of this is present anymore. Nothing. And a big portion of it, because I started strength training, I started paying attention to what I can lift instead of what can I lose, right? How much can I lose? I was like, let's see how strong I can get. And that's the same mindset that I really recommend that you take on. If you are a woman especially who feels like small, like I don't have a voice, I can't do this and that, or constantly obsessed with your body, start focusing on the things that you can gain and not so much on what the scale says. Now, the second thing, and now this has directly to do with chronic pain and chronic sensations. The really cool part when it comes to like empowerment and strength is that when you start strength training, so many times I've seen people reducing their chronic sensations. These sensations just start going down. And why? This is not because by strength training you fix some kind of muscular imbalance or some ligament or tendon gets better. It's none of those things. Or because now you're suddenly like aligned better. I remember when I was having like really bad back pain, I was told like, you have to strengthen your glutes, you have to strengthen your core. Why would they be so weak if I've been working out all the time? Why? It didn't make any sense to me, but I was like, I guess I have to do this then. Well, that didn't help, right? Like I didn't get rid of my back pain because I strengthened my glutes and now my abs are rock solid. It's not that. But the reason why a lot of people start getting relief from their chronic sensations when they start strength training is what it does to their minds, to their brain and nervous system. So when they show up for a strength training session, and let's say that you are a complete beginner, never done this before, what you're going to do is that you're going to show your brain that I can do this. I'm not afraid of this. This is a normal thing. All healthy people lift weights. Well, most, right? Or many healthy people lift weights. I am healthy. I know I'm healthy. So there's no reason for me to be afraid of this. I'm going to go and do this. I'm going to do just like 3 rounds of squats and show myself that I can do it. So it's the attitude. It's the attitude that is changing things for you. And of course, you may get a little setback, so-called, after doing these 3 sets of 10 squats if you're a beginner, because your nervous system may not be used to it. But here's your chance. You're not going to back off. You're not going to tell the nervous system, oh, I'm sorry. I'm so sorry I did this. This was a bad decision. You're not going to do this. You understand that what you did was okay. And while you're doing it, before you start it, I also recommend that you prep your mind a little bit. You prep your nervous system a little bit. You do something calming and kind of confirming that what I'm about to do is totally fine. It's totally normal. You go in with the mindset of like, this is the most normal thing. Like, this is like breathing. I breathe, I can do squats, I can do all kinds of things, right? There's nothing extraordinary. I'm not about to go and run a marathon with like 100-pound weighted vest on my back. I'm not doing that. I'm doing just some exercises, just some squats. This is normal, this is cool, this is what I'm going to do, and I'm not going to give up. So this is the attitude. This is what helps you to reduce symptoms potentially. Okay, I can't say that this is the cure for everybody, right? Because there are many, many details that have to be taken care of in order for you to recover from these chronic sensations, anxiety, and other things. But you also will get a lot of help from this when you just show up and show to your brain and nervous system, I got this, I'm not afraid. And if you want to see a fantastic story that backs all up that I just said, go ahead and watch Amanda's story interview that I did with Amanda Boyd. I'm going to link it into show notes so you can find it, watch it, and see what she has to say. And she's absolutely wonderful. Like, she's working now almost every week, 3 days a week. And she's like, I'm not letting that go anywhere. It's the best thing I've ever done for my health. Go and watch that story and get inspired. The last thing that I want to tell you when it comes to strength and empowerment for people who have chronic sensations is that doctors don't always know the truth. And I think this should be clear already by now, by what you've heard in this podcast, that a lot of times the really well-meaning healthcare practitioners can get it totally wrong because they don't ask about your stress. They don't even consider the fact a lot of the times that your sensations could be caused by stress and nervous system dysregulation. And part of it is that they don't know, which is a part of a bigger issue here, which is our education, right? They just don't know. There are other reasons, I think, too. I'm maybe not going to talk about it a whole lot right now, but the point being is that they just are not trained this way. They don't know. And everybody sees the situation from their viewpoint, right? There's this chiropractor who's like, yes, you have this and that problem, right? That sees the problem through his lens. And then there's a surgeon who sees the problem through his lens and wants you to go get surgery. And then there is a physical therapist who tells you that your spine is somehow misaligned, or sees the thing through his lens. Everybody sees the stuff through their lens, and nobody usually knows to ask you about your stress. Nobody asks you about your trauma or something that you're going through right now, or your anxiety. Are you constantly anxious? Maybe that has to do with your stress. Doctors just don't know. So I would encourage you to be a little bit more what would be a good word, just to think a little bit more for yourself, not necessarily always trust the first thing that you've been told, especially if the diagnosis is something really devastating. And of course, I have to say this, I am not a medical doctor, and you should listen to doctors. Yes. And also see maybe there are other options, like maybe this is a nervous system problem. Maybe it is because you had a really traumatic childhood and your nervous system is still reliving these things. Every remotely dangerous situation that happens in your body right now, that's actually not even dangerous, but is sort of similar to what happened in your childhood, it's creating the same response in your body. Your nervous system goes on high alert and you get the pain and sensation. Like, these things are real. And again, always get checked out by a doctor, a healthcare provider. You have to take their advice. And also think, now you have this information that I've given you, maybe something else is possible too. Like in my case, my chiropractor told me that I don't think you should ever deadlift again. You shouldn't. Your back is so bad. And I can deadlift. I can deadlift whatever I want. I can. And this was, when I heard this, I was, of course, devastated. I was like, damn it, like, really, this is my favorite lift. I've always liked working out. Like, oh my God, like, what is so wrong in my body that I cannot just pick up a bar from the floor, stand up with it and put it back down? Why can I not do this? What's so wrong? There's nothing that came out from like imaging studies or the images that could have justified that level of pain. And even if your images show you that you have a bulging disc, there's so much experience that shows that bulging discs are not causing pain. There are like so many people out there with bulging discs and no pain. And there's so many people out there with tons of pain and no bulging discs. There's me, like, there's nothing wrong with my spine, but I had a lot of pain. And, I was told that you should never deadlift again. Not true. It wasn't true. So that's why I want to tell you to just like think a little bit more for yourself. Like, question things. Yeah, that's what I want to say. Like, question things and be open to the possibility that the people who have like best, they wish you best, but they may not know. They may not have the right answer. And maybe the answer is what I'm talking to you about on this podcast. Maybe it is nervous system. Maybe you have to regulate your nervous system. Maybe you have to create safety in your system for your sensations to start going away. So to go over one more time real quick, 3 things that you should know about empowerment and strength training. Number 1, focus on what you have to gain from strength training. Don't focus so much on everything that's wrong in your body and how much weight you lose. Number 2, starting strength training can often help you to reduce your chronic sensations. And number 3, healthcare professionals don't always know exactly what is going on with you, and it is your job to find out what's the actual truth. And there's a really good chance that if you've had these chronic sensations for a while, it is actually your nervous system where they are originating from. So also go ahead and check out my program, Strong and Sensitive, like I mentioned before, the 14-day course. And if you're ready to take the next step, then I also do have 2 strength training programs that you can buy. One is Train to Build Starter for complete beginners, and the other one is Train to Build Intermediate. So check out one or both of them to start your strength training in a really safe way that actually also helps you to get stronger and build muscle and feel good in your body. So thank you so much for being here today. I appreciate you, and I'll talk to you again soon. Take care.